Welcome to IVF Success Secrets, brought to you by Procare Hospital Abuja. I'm your host, Ramona Salim, and with me today is Dr. Fachi. Dr. Fachi, you're welcome.
Thank you, Ramona. Pleasure to be here once again.
When is the right time to take a pregnancy test after IVF?
Basically, after the embryo transfer, it takes some days for implantation to occur, and it's after implantation that the pregnancy hormone starts being secreted. And it's good to allow the first few days for this process to occur. As much as we know that this hormone is in the blood earlier than, maybe about 12 to 14 days, the recommendation usually is for patients to not test at least earliest before 12 days after the embryo transfer. So 12 to 14 days usually is the recommended time for patients to test after embryo transfer. So testing too early, like I said in the earlier episode, could lead to having false hope or losing hope too early. And so in that case, patients might carry out actions that are detrimental to the treatment. So 12 to 14 days is a good time to do pregnancy test after an embryo transfer.
What does the beta HCG test annually measure?
All right, beta HCG, which is a human chorionic gonadotropin, that's the pregnancy hormone. And so the implanting embryo secretes this hormone. And so that is what we measure during the pregnancy test. So most times what we do initially on the day of testing, we ask women to test at home using their urinary strip just to give them an idea. And then they come to the hospital where we would take the blood and measure the amount of beta HCG in their blood. So certain levels, denote positivity. And then so once that is checked and the test is positive, we would usually repeat maybe 48 hours later in some cases to ensure that it is rising or doubling adequately, which may show that, okay, yes, the implantation was okay.
What are signs of a healthy progressing pregnancy at this stage?
Basically, it's a properly doubling pregnancy beta HCG level. So if you measure the first one that confirms pregnancy, you might decide to repeat after 48 hours to just see if it is rising. Sometimes patients may also begin to have pregnancy symptoms during this phase, which is more reassuring that the pregnancy is going on well.
So what if the HCG level is low or not doubling? What does that mean?
Yeah, a low HCG level may mean that the pregnancy implanted, but then it is failing. And this usually results into what we call chemical pregnancy, where the pregnancy never made it to the point that it is picked by ultrasound. So that's what we call biochemical pregnancy. Sometimes it may also, especially where the levels are not rising, they are not doubling as expected, it might also mean that it's an ectopic pregnancy. And so you need to do more follow-up to determine is it a failing pregnancy or is it an ectopic pregnancy.
How long do patients typically continue hormonal support from a positive test?
For a positive test, usually up to 12 weeks. Sometimes we stretch it to 13 weeks just to be sure that the placenta is adequately formed and have taken over the function of hormone production to support the pregnancy.
Thank you, Dr. Fachi.
Thank you, Ramona.
On this episode, we have looked at the pregnancy testing and what happens next. I hope you were able to pick one or two things that you will use in your own journey. Join us for the next episode where we will be talking about if IVF fails, what to do next. Thank you for watching. Stay with us always.